I want to welcome you to the Hot Years, and this is brought to you by the hotyearsmag.com, where you can get a subscription to the magazine for free. And I have the pleasure of speaking today with Dr. Pinkerton. Dr. Pinkerton is a professor at the University of Virginia. She's director of the Midlife Health Clinic, and she is also the executive director of the North American Menopause Society, and a very knowledgeable lady on top of that. And so I want to ask you, we were talking about this new diagnostic tool for menopause, like there's a test maybe for menopause. And I wonder if you could share a little bit about that. What is this test?
So the new test, its abbreviations are AMH. It stands for anti-Müllerian hormone. It's a test that's been around for a while, but now we have a commercially available, FDA-approved tested variety. So we know that we're going to be getting very sensitive answers. And it can tell you within some parameters how long it will be before a woman goes into menopause.
Now, it's not going to tell you tomorrow's my day, right?
No, it's not that exact, but if you take age and the test, you can get, whether you might be within 5 years of menopause or within 10 years of menopause. So for most women who have menopausal symptoms, they're skipping periods, they don't need a blood test. They already know that they're in that late perimenopausal transition. So those won't be the people who are using it.
Well, would it be helpful for women who were thinking about starting their family or continuing their family later in their life, or maybe a second marriage or something? And would that be a time they might consider this?
I think women who are having trouble getting pregnant or delaying childbearing, I think it might be very helpful, because if you find out that you are within 5 years of menopause, that means that even in vitro fertilization may not work as well. Versus if you find out that you're within 10 years of menopause, you have a much better chance of going through the testing. And it might also be important for women who've had chemotherapy to see if they're not having periods just because the ovary is quiet after the chemo, or whether there's really no ovarian reserve. And that's the key word for women trying to get pregnant, is how much ovarian reserve do you have? And this test can help. How
many eggs are left in the basket, so to speak? And so a final question I want to ask you is that if I wanted to get this test, where would I go to get it? Is it available to everyone?
Well, whenever something comes out that's just FDA approved, it takes time before it becomes available in different labs. So you can get an AMH at most labs. It's a send out. But my belief is that over the next year or so that this commercially available test will become available, across the country. I mean, that's their goal.
So it's a doctor's office thing. You don't go into your local drugstore and get something, pee on a stick and so forth.
I wouldn't do that. I think if you want to know what your ovarian reserve is, you need to see a specialist who can put a test in context with other pieces of information about you. The delaying pregnancy, desiring to get pregnant, these are huge emotional issues. This test is one more piece of the puzzle.
Right. Well, thank you very much.